We've had a great morning and a terrific lunch, and Mitch Daniels was a terrific speaker, and we also have a great afternoon. So we're delighted to welcome the next panel, which will discuss how the food system can be leveraged to improve nutrition. And we are pleased that Monica Eng, who hosts the popular program Chewing the Fat, I guess it could be chewing the protein or chewing the carbohydrates, but this is chewing the fat.
Right.
On WBEZ Chicago Radio will chair. So I'll turn it over to Monica.
Thanks so much, Dan, and welcome everybody back. I'm so glad it was a low-carb lunch, so you're all going to be nice and alert. I hope you had your coffee. I am so pleased that we have an all-star lineup of food professionals here. To my right is Shawn Baker, Director of Nutrition at the Bill and Melinda Gates Foundation. Next to him is Sunny George Verghese, Co-founder and Managing Director of the Olam International. Richard Greene, Senior Deputy Assistant Administrator at USAID. Stefan Schmitz, Deputy Director General and Commission at One World. Thanks so much for joining us. Let's kick it right off. Now, Shawn, let me turn my page. Recently the Gates Foundation launched a brand new nutrition strategy that complements your work on agriculture and development and health. What are the foundation's priorities, and where do you think you can move the needle on nutrition?
Thank you, and thank you to the Chicago Council for having me, and good afternoon, everyone. Many of us are here today because we know the devastation that poor nutrition brings to families around the world. It is the single biggest driver of under-5 mortality. It stunts children's cognitive development. Stunting affects 1/4 of all children worldwide. So they struggle to learn in school, and when they grow up, they will find it harder to get a job and to give birth to healthy children. This underdevelopment in children creates a vicious cycle of poverty. But the poverty cycle can be broken. And we are starting to see glimmers of hope around the world, thanks to many of the people in this room today, donors, developing countries, NGOs, and other institutions. We are making major strides in putting good nutrition at the center of the development priorities. Our foundation is one of those partners, and we have gone on an important journey during this strategy revision to get there. For far too long, the world is underinvested in nutrition, and we at the foundation have also underinvested in nutrition, as many other donors did. Undernutrition is a complicated and often hidden condition. In many countries, stunting is so ubiquitous, you really can't see the shocking inequality that exists. We know that deficiencies in essential vitamins and minerals are invisible. Also, there are no ministries of nutrition, so it's very hard to create ownership or to drive accountability. We have learned a lot in recent years about how vital it is to invest in nutrition for children to survive and thrive. And we now at the foundation have a new strategy, which has actually not been launched. That's for Melinda to do on June 3rd. And I wanted to share with you today some of the parts of that strategy we're most excited about. We maintain a commitment to scale the things we know that work, such as breastfeeding, food fortification, salt iodization, etc. We want to really double down on maternal nutrition because of the growing recognition of the importance of ensuring that we cover the prenatal period. We will continue to invest in new solutions because we know that the burden can't be fully addressed by existing solutions. We want to be more guided by country needs so we respond to system-wide challenges in scaling delivery of nutrition. And our new food systems initiative, which is jointly owned with our agricultural development colleagues, and that's what I want to spend a bit more time speaking to you about today. At the heart of this new initiative is an understanding of the role that the agriculture sector can play beyond boosting productivity to providing nutrition benefits for families and societies as a whole. We have some experience in this already. Our biofortification work is showing great results in helping improve diet quality in many settings. We know that putting smallholder women farmers as the center of agricultural development results in multiple benefits. Our work on reducing aflatoxin contamination is starting to improve the safety of food supplies in some African countries. But we have a lot more work to do if we are going to make higher quality, more nutritious foods available and accessible year-round to the poorest people in the world. Part of this is getting nutrition more embedded in extension and production systems. A good example is the recent CGIAR commitment, and I quote, to mainstream breeding for mineral and vitamin traits into conventional food crop development programs. It is also about driving consumer demand for more nutritious foods. It is also about getting more evidence of what works and through what pathways, so we can scale up these programs. Part of the food system solution is making markets work better for the poorest. Even those people on the poverty line buy most of their food on the market. Therefore, we must find ways to ensure food arriving at the market is safe and nutritious, and that food doesn't come with a price tag that makes it unaffordable for the poorest. We can partner with private sector so they can see the value of helping improve quality control and incentivize smallholder farmers to bring safer, more nutritious foods to the market. In addition, companies can scale up their lines of fortified products, which can have a big impact on deficiencies in vitamins and minerals. We should support local and regional companies to expand their work in nutritious agriculture value chains. While large companies may focus on the next billion in processed foods, these products are often out of reach of the poor. But by solidifying local company investment in commodities like livestock and dairy, and bolstering their capacities through technology transfers, we can help ensure that poor consumers can access nutritious food. As many of you in the room know, the issue of private sector engagement in nutrition is often quite contentious because of concerns of inappropriate marketing. The report being launched today recommends, and I quote, promoting and strengthening voluntary guidelines to limit marketing of foods and beverages to children globally. One of the longest standing set of such guidelines is the International Code of Marketing of Breast Milk Substitutes. Inadequate compliance with the code continues to be a major concern in its own right, but also exacerbates mistrust about the private sector. Our renewed commitment to code compliance is essential to leverage the private sector's role in nutrition. We know progress is possible. We have seen child deaths come down dramatically in recent years, but we have not really moved enough to reduce the deaths and compromise development that are due to malnutrition, and this is not acceptable. The world came together in 2013 to sign a global compact and help to get many partners to invest more in nutrition. Thanks to that day and the leadership of many of you in the room, we have programs that will help ensure equitable access to safe, affordable, nutritious diets year-round for the most vulnerable, and to contribute to saving more children's lives and ensuring they realize their full potential. But there is no room for complacency. Less than 1% of ODA is allocated to nutrition, even with the improvements that we've seen since 2013. So it's important that we work together to ensure we put nutrition at the heart of our food systems to finally see that a cycle of poverty is broken for good.
Thanks so much, Shawn. I know we all look forward to seeing the details of that strategy. It sounds very interesting. Now, Sunny, Olam is operating in 65 countries, supplying 44 agricultural commodities to its more than 13,600 customers worldwide. It directly farms 21 crops in 26 countries. And I know that sustainability is a big part of your business, but can you describe the broad elements of this strategy and what role nutrition plays in it?
Thank you, Monica. Firstly, let me say how delighted I am to be here this afternoon. Probably I'm one of the panelists who's traveled the longest to be here. From Singapore, 24 hours. Wow. So a poor example of a sensible environmental footprint to come and participate here. But this couldn't have been done by a video conference or any other method. It's about really entering into a dialogue with the people that's gathered in this room, so I'm delighted to be here. Our philosophy on sustainability is really guided by our view of what the major developmental challenges are that face us this century. And I believe there are 6 key developmental challenges that we all face. The first is food security. The second is water security. The third is energy security. The fourth is the impact of climate change. The fifth is sustainable growth. You can find the growth, and like the governor mentioned in his keynote address this afternoon, I'm not one who believes that we won't be able to feed a growing population. I think we can. But the cost of doing it in terms of whether you can do that sustainably without massively depleting natural resources and natural capital that we derive benefits from is the fifth challenge. And the sixth challenge is about inclusive growth. In the 100 years in the 20th century, populations quadrupled, global economies grew 20-fold, and yet inequality has risen. And even in 1990, when the global economy was a GDP of $27 trillion, it has grown almost fourfold since then to now. But the people who are hungry and undernourished we've only made a small dent, from 870 million people in 1990 to about 805 million people today, despite all of that progress. So really, there's something fundamentally wrong in our developmental models. And I think the drivers that lead to these challenges are quite obvious to all of us. On the demand side, we have a growing population, 80 million people being added to the world population every year, and therefore 80 million new mouths to feed. But that's not a new challenge for us. We have coped with it admirably well in the past. But the second is really a game-changing event in terms of the growth in the transition economies and what that means to middle class. So in the Industrial Revolution, the UK, with a base population of 10 million, took 153 years to double its per capita incomes. The US, starting roughly 130 years later, also on a 10 million population, took 55 years to double the per capita incomes. Germany took 63 years, but China and India are today growing the population, growing the per capita incomes every 12 years and every 16 years, and not on 10 million population base, but on a combined population of about 2.5 billion people. We have not witnessed that in our lifetime. That is game-changing. We had 1.7 billion people in the middle class. We are now going to be about 4.7 billion people in the middle class by 2030. And almost all of that growth is going to happen in the transitioning economies. And as a rough rule of thumb, people in low-income countries consume about 2,500 calories per capita. In the middle-income countries, it's 3,000. And the high-income countries, it's about 3,600 calories. So as this transition happens, you will see a significantly incremental demand for calorie consumption, and somebody has to be able to provide that on a sustainable basis. The third, as a result of all this, is also the dietary change in habits from a carbohydrate cereal-based diet to a protein fat-based diet. China was consuming 15 kgs of meat per capita in the mid-80s. Now it is 55 kgs of meat per capita. In the US, you consume about 110, 120 kgs of meat per capita. And in the past, we said it's cultural. The Chinese and Indians can never eat as much meat as the Westerners do. But Hong Kong and Taiwan, which are greater parts of China, today consume 100 kgs of meat per capita. It's all about economics. If you can afford it, you want to eat more meat. So China today consumes 50% of all the pork meat that is produced in the world. It consumes 40% of all the eggs that is produced in the world. It consumes about 19% of all the poultry meat that is produced in the world. It consumes 12% of all the beef that is produced in the world. A third of the world's rice is consumed in China. A quarter of the world's soybeans is consumed in China. 18% of the world's wheat is consumed in China. I don't believe that China and India have any hope in hell of being able to feed themselves in 20 years' time. They will be massive net importers of food, and somebody will have to supply that to them. And this notion that China and India can become more efficient agricultural producers if they just aggregate and get into large-scale farming, more efficient farming, that will never happen. China has got about 570 million people engaged in agriculture. India has about 550 million people engaged in agriculture. If an economy like the US struggles to find jobs for 14 million people, what hope in hell does China and India have to allow rural migration to urban centers at a scale that people are talking about to make it more efficient agricultural systems? Not going to happen. The fourth issue is, as if all this was not enough for us, we have shot ourselves in the feet by diverting more food and feed raw materials into the biofuel complex. 40% of the US corn crop last year was diverted into ethanol manufacturing. 52% of the Brazilian sugarcane crop went into ethanol manufacturing. 12% of all the world oil seeds produced last year went into biodiesel manufacturing. And on the supply side, we have reducing arable land. I remember in China in 2004, there was panic when Chinese grain production came down to 430 million tons. And they launched a massive program to change that situation. One of the decrees that was passed in 2004, no new golf courses to be built in China on arable land. Since then, we've got 450 new golf courses that have come up on arable land because they just reclassified it as degraded land. And you can do whatever the hell you want with degraded land. China has about 119 million hectares under cultivation in its food crops. The Chinese government has a food self-sufficiency policy that should produce 95% of the food it consumes. But for that, we believe it needs at least 125 million hectares under cultivation. And therefore, China imports 60 million tons of soybeans. China is deficient in water, and which I'll come to in a minute. And therefore, the best way to import water is to import a cape size full of soybeans from Brazil or Argentina or the US. And that's how it's going to cope with that problem. And if China had to just become self-sufficient in soybean cultivation, it has to put another 34 million hectares under cultivation, out of a total of 119 million hectares. And out of that, only 19 million hectares in food crops. Again, it's going to be a huge challenge to really confront effectively and sustainably. The big elephant in the room is water. In China, in the northern plains, which grows half its wheat, a third of its corn, water tables are receding at 3 meters a year. In the in the western part of India, Gujarat, where the water tables are receding at 6 meters a year. According to the WHO, 90% of all Chinese rivers and lakes are polluted. If you look at Lake Bam in Burkina Faso or Lake Chad, in the last 10 years, the volume of water in those lakes have come down by 90%. We have seen that in the Aral Sea before. Today, we consume roughly 4.9 trillion cubic meters of water. 71% of that goes into agriculture. And by 2030, we will need about 7 trillion cubic meters of water. So where are we going to get that additional water from? There are a couple of ways that can address partly that problem in terms of better irrigation efficiencies, drip and everything else, or more drought-resistant varieties. But it is a major challenge that we need to contend with. And all of us, if you remember, as a rough rule of thumb, my breakfast yesterday, today I had a very healthy breakfast here. But yesterday I had indulged in a very heavy breakfast in New York. And it's about roughly 1,100 calories. 2 eggs, fried eggs, is 130 calories. 130 liters of water. A cup of coffee is 100 liters of water. And if you take 2 strips of bacon, it is 270 liters of water. You total it all up, as a rough rule of thumb, every calorie that you eat, you consume 1 liter of water. In the US, you consume 3,600 calories of food, it's 3,600 liters of water. And then you take 55 liters of water for your household purposes, 1 or 2 liters of water that you drink. And today, according to the UN, 47% of the countries would be water stressed by their definition of having at least 1,700 cubic meters of water per capita per year. India is already below that. China is getting close to that. Excepting for places like Brazil, which has 40,000 cubic meters of water per capita, US has 5,500 cubic meters of water per capita, it is going to be a problem. There was a company called TrueCost, which did a study last year about the world's largest 3,000 companies and what was the externalities they created. That is, how much did they derive from nature for which they didn't pay because Mother Nature's back office is not set up and therefore it's not issuing those invoices. And they found that these companies made a profit of $6.5 trillion that year in 2011 combined. And the externalities that they took from nature was about $2.15 trillion. So we took 6 years as a company to map a carbon dioxide footprint, emission footprint. And we now know that almost half the profits that we made last year went, if we had costed those externalities in terms of the carbon dioxide that we emitted and the water or waste footprint that we left behind, half of the profits would have been accounted for by that. So we took a look and said, what is the value of all this overwhelming effort operating in 65 countries, growing 21 crops, if this is the balance? So I think unless we price carbon, behavior is not going to change, and we're not going to have a sustainable future.
All right, did everyone get all those numbers down? I am astonished at your ability to keep all those figures in your head. That's sobering news, sobering statistics. Next, I'd like to talk to Richard Greene. Richard, at this event last year, Ambassador Susan Rice announced the new USAID nutrition strategy. Where are we with that strategy right now, and how is it being implemented?
Thanks very much. Yes, last year in this very room, we launched the USAID Multi-Sectoral Nutrition Strategy, which aims to promote nutrition by using a variety of our funding accounts and our initiatives, including Feed the Future, the Global Health Initiative, humanitarian programs, our resilience activities, and Food for Peace. And one of the goals of this was to elevate nutrition on the development stage. And we're very proud that Feed the Future has placed stunting reduction as one of its 2 major goals. The first time that a presidential initiative has elevated nutrition to that level. And nutrition is central to the Ending Preventable Child and Maternal Death call to action, recognizing that 45% of child deaths are associated with undernutrition. Now, our primary focus remains on prevention of undernutrition in the first 1,000 days from pregnancy to a child's second birthday. And this we will do through a combination of programs: food security, health, water, hygiene, sanitation, women's programs, etc. But we also recognize that undernutrition in the first 1,000 days not only leads to mortality and morbidity among children, but also longer-term problems such as cardiovascular disease and metabolic disorders. Now, our strategy has several ambitious goals, including reducing stunting by 20% in Feed the Future implementation zones and global health zones, resulting in 2 million fewer stunted children, but also maintaining acute malnutrition below the threshold of 15% in humanitarian situations. So, it is now a year later, and as I'm reminded every day, we're accountable. So what in the past year have we done to implement this new strategy? First, we developed a set of implementation guidelines, including on nutrition-sensitive agriculture, data-driven nutrition programs, and integrating nutrition with maternal and child health. 2, in the last year, and most important, we have greatly expanded USAID nutrition programming, and we now have expanded or new programs in about 10 countries, including in places like Cambodia, Ghana, Mali, etc. Many of these expanded efforts combine nutrition-specific and nutrition-sensitive interventions, beginning to bridge the gap between agriculture and nutrition. Third, during the past year, we greatly enhanced the integration of Feed the Future and Food for Peace development programs in places like Bangladesh and Guatemala and Ethiopia. As part of this effort, we are exploring ways that Food for Peace development programs, Food for Peace beneficiaries can graduate into FTF, Feed the Future programs. This means working in many cases in the same communities, with the same vulnerable households. Fourth, during the past year, we launched new research to expand the evidence base for nutrition-sensitive programming. For instance, our Nutrition Innovation Lab is looking for the factors that lead to stunting, including water, hygiene, sanitation, issues, environmental contamination, overweight, and obesity. Now, there are 2 major elements of our strategy I'd like to focus on. One is finding ways to promote nutrition in other development programs. And it begins with promoting exclusive breastfeeding in our maternal and child health programs. 2, promoting water, hygiene, and sanitation to prevent the vicious cycle of infectious diseases leading to chronic undernutrition. 3, expanding legume production for soul fertility and better nutrition and better diets, and launching more dairy and fish programs. These are examples. But of course, none of this matters if the nutritious foods which are produced are not consumed. This has been the issue historically with horticulture and gardening programs. Almost all the produce is sold. This is why we are now systematically trying to track consumption of these nutritious foods, the vegetables, the fish, the dairy, among the families that produce these foods and among women and children more broadly. For instance, one of our fish aquaculture programs now report that more than 50% of its produce is being consumed by the producer families themselves. This is a good start. A second important issue for me is making nutrition programs more data-driven. For instance, let's focus on effective coverage of interventions such as micronutrient fortification, making sure it reaches the right populations at the right time with the right amounts of fortificant. Also, in general, making sure we monitor our interventions on the ground to make sure that behavior change programs actually work the way they're supposed to and promote change. Last year, the Chicago Council Symposium theme was climate smart agriculture. And there was a clear connection between nutrition sensitive and climate resilient agriculture. For instance, by promoting legumes, not only are we adding biologically fixed nitrogen to the soil and improving the soil, but we're also improving the nutrition of diets if they're consumed. Drought-tolerant maize, a key element for us, helps smallholders to produce the fodder that will lead to poultry and egg production, which is critical to nutrition. We are now finalizing the U.S. government nutrition coordination plan, which will help U.S. agencies to better coordinate our approaches to nutrition and collectively improve our contribution towards the World Health Assembly targets. We expect and plan to launch this important plan later this year. You know, nobody likes to fund intractable problems, and certainly nutrition, especially stunting reduction, has historically been very difficult, a noble effort with not much results. But this is clearly beginning to change. We have new, exciting evidence of dramatic progress in places like Bangladesh, Ghana, Ethiopia, Kenya, where stunting rates have gone down by historic margins. So now we really feel we have the strategies and we have the commitment to accelerate this progress. And we feel the U.S. government is poised to play an even greater role in making this happen. Thank you very much.
Thanks so much, Richard. Sounds like impressive results. Legumes, good for the soil and good for you. Don't forget. Now, Stefan, in just a few weeks, Germany is going to be hosting the G7 meeting. How will its G7 agenda handle food security and nutrition?
Thank you, and I'm very grateful to the Chicago Council for giving me the opportunity to share our views with you. It is a great achievement, first of all, that the international community has started to look beyond just the serious issue of hunger and now addresses hidden hunger as well. Still, 800 million people worldwide are suffering hunger, and more than another 1 billion people are suffering hidden hunger. So altogether, about 2 billion are undernourished. At the same time, maternal and child mortality is very high. There is a very strong link between these two global scandals, undernutrition on the one hand and maternal and child health issues on the other. 2015 is a very important year for development. Actually, it is a crucial year. Later this year, the international community will agree on sustainable development goals as a new global compact for development. And at the end of the year, a crucial summit for climate will take place in Paris. This year, as said, Germany holds the G7 presidency. Germany has put food security on the agenda of the G7 summit. Germany pleads and stands up for an ambitious commitment of the G7, a commitment that is visible, that will make a difference, and that will come up to the responsibility of the G7. We like to see an ambitious contribution to the eradication of hunger and hidden hunger by 2030. And with that contribution, we would like to send a strong political message to the other crucial events later the year. Yes, a better world without hunger is possible. We do see this because we are convinced that food and nutrition security, next to poverty alleviation and health, is key to development in general. Only well-nourished children are able to learn properly, and only well-fed people are able to lead a productive, self-determined life. Germany is convinced a world without hunger and hidden hunger is possible, but no doubt, to get there, business as usual is not an option. Germany is convinced that, compared to what has been done in the past, a broader approach is needed to fully address food security and nutrition. Discussions in the G7 are currently still ongoing, but we already identified key fields of action. Productivity in smallholder agriculture needs to be increased. We have to bring smallholder in particular out of the poverty trap. We need to support smallholders in being able to deal with climate change. Investments in agriculture are needed, but all investments, not only those in smallholder agriculture, need to be responsible. Production needs to be sustainable, more and better output, but less input. We need to be people-centered, but at the same time, planet-sensitive. The role of women definitely is to be strengthened. Their role in agriculture, but also in nutrition. We need to break the vicious circle of bad nutrition and bad health. Instead, food policy and health policy need to be linked and be mutually supportive. And last but not least, we have to pay greater attention to the fact that fragility and crisis play a growing role as root causes of hunger. We need to strengthen the resilience of people and communities and have to do a better job in linking relief, rehabilitation, and development. At the same time, the effectiveness of all our efforts must be improved. Corporations programs need to be better targeted. Ownership of partners is key. The way we cooperate among each other, among donors and with partners, needs to be improved. Monitoring and accountability have to be put center stage. Within the G7, Germany is ready to play its role and to contribute its share to that ambitious undertaking we are striving for. Germany has launched the One World, No Hunger initiative, and probably I get the chance to go into detail later in the discussion. Thank you.
Absolutely, thank you. So I'm going to throw, thanks. So I'm going to throw a few questions out to all of you and those who feel they'd like to answer can. Where do we have the greatest opportunity to make our food supply more nutritious right now? Anybody care to take that easy question?
I'll be happy to start, if I may. Okay. So I actually want to steal one of Richard's themes, and I heard it echoed by others, to come back to the data issue. I think that while we talk a lot about food systems and we talk about trying to get different sectors to work together, I think one of the biggest obstacles we face is we don't have a common language. And at the end of the day, the common language has to be better understanding what are people actually consuming to get better consumption data so that we actually can then have policy dialogues about how do we make a food system that works better to deliver nutrition. So I think much better investment, because at the end of the day, if people are not consuming the nutritious foods, we're not having an impact. And there's some quick wins that have been spoken about today that we can quickly, once we have that data, then design fortification programs to get vitamin and mineral content up very quickly. And we're also seeing great progress in the plant breeding programs for biofortification to also then adjust your breeding programs to bring breeding for essential vitamins and minerals into the system very quickly. Then I think the other big win that we can move quickly on is really reorienting our ag extension systems and our food value chains to put women, particularly smallholder women farmers, getting them the access to the inputs and really linking them up to the whole supply chain. And that's been shown to have quite dramatic impacts on nutrition.
Anybody else? Richard?
Yeah, anybody who's looked at a Road to Health card in a health facility in Africa will notice that when kids fall off the road to health, it's because of an infectious disease. And so improving food safety to cut down on the infectious diseases, most of which are foodborne, I think is probably the first thing. The only other thing I would really like to mention is anything we can do to save women's time and energy expenditure will allow them to spend more time caring for their children. I think these are two things that could help immediately.
All right. You know, we've heard a lot about fortification in this conference, and I cover school food, among other things. And there was this one example where the kids were being fed donuts pretty much every day, and they were told, well, they're healthy donuts because they're sprayed with fortification. And so critics of fortification say that sometimes it can just be a vehicle for peddling processed foods to people. What would you say to that? What would supporters of fortification say to that?
You want me to take that?
Well, whoever
Such an easy question.
I'll look for some.
Wow.
I'll look for some armor here.
I think that that's an important issue, and I think what in fortification we have learned over the last 15 years or so of taking this outside of industrialized countries is it's really important to early on focus on, one, the evidence of understanding which are the foods that the people we're most concerned about are consuming that lend themselves to fortification, and then quickly move into a mandatory fortification environment. So you actually have, based on the evidence, based on dietary requirements, you're setting fortification standards that are meeting those nutrient needs. I concur that, you know, if fortification is taken just as a marketing strategy, that's not really the purpose. And in fact, the good fortification programs, you don't need a strong social and behavior change communication underpinning because you need some information to the consumer so there are no fears of adulteration of the foodstuffs. But in fact, you're taking the vitamins and minerals to what consumers are already eating.
So you're talking about the iodization of salt, or?
Talking about iodization of salt, iron, folic acid, and zinc fortification of cereal flours, vitamin A fortification of cooking oil. And those are the programs that tend to have a very broad reach. Again, that becomes context specific and where you have an evidence base of what people are really eating.
Okay, anybody else?
Yeah, I think in the morning in the panel, the first panel, I think one of the burdens that was being expressed was, I think the objectives are quite clear. Nobody in this room will quibble about what the objective should be about the nutrition objectives that we want to achieve, but it's all about the how. And there, I think the models are, one, mandatory, that the government dictates that, you know, all these foods should be fortified, or certain kinds of foods will attract obesity tax or sin tax or whatever you want to call it, to change or shape behavior. And I've seen in countries where we operate, in a country like Nigeria, for example, the government came up with a controversial policy that all sugar that is sold in Nigeria has to be vitamin A fortified. I haven't heard about that in any other country that we operate.
Wow.
But they stuck on that policy for the last 10 years, and now every sugar that is sold in Nigeria has to be vitamin A fortified.
So it's virtuous sugar.
It is. It's probably not the best alternative. I would suggest that sweeteners are better alternatives, but I have a vested interest in sweeteners. We manufacture stevia, which is a high-intensity natural sweetener, which has 250, 400 times the sweetening intensity of sugar. And today, Coke has launched a brand called Coke Life, made exclusively from that ingredient. So I don't know how many of you have seen a green Coke can. It's just been launched in the US, yes. So it's been launched now in 12 countries, and it's 55% sugar reduction in the US. The versions that are in South America has even higher sugar reductions through use of this product. So partly it is voluntary. So in our packaged foods manufacturing and distribution business in Africa, in our tomato paste brands that we sell there, we fortify it with vitamin A. In the yogurt, drinkable yogurts that we sell there, we fortify with vitamin A and vitamin D. With the milk biscuits that we sell there, we fortify with calcium, all of the milk biscuits that we sell. So that is one way of getting private sector to do the right thing. But I think it has to be also facilitated through enabling legislation that changes that behavior. So as I mentioned earlier, if carbon is free, then none of us are going to be really bothered about how much carbon we emit.
Okay. Anybody else before we move on to the next question?
I would intervene about the sugar fortification. A couple of points. One, and actually in Central America, I think sugar, there are others in the audience who can give all the details, but it actually has been, over the last 30 years or so, one of the great success programs in bringing down vitamin A deficiency. I think the important thing is that the purpose of that program is not to promote sugar consumption.
Yes.
It was based on the evidence of what people were consuming already, and
yes.
how do you put a nutrient in there. And so I think this is where it's important to make the difference between if you have a mandatory fortification program that is designed for a public health outcome, you're not actually promoting that, oh, eat more of this food. Mm-hmm. You're basing your fortification standards on the levels of people are already eating.
Right.
And then this is where it's important. And I come back to where it's then also important to have this good consumption data, as Richard had said, because you need to understand, is that actually reaching the populations you need?
Sure.
And are there any unintended negative consequences? Because you could get to situations, if you pile on too many voluntarily fortified products, you might get beyond what you would like. And so that the data-driven programs are absolutely essential, I think, across everything we do.
Speaking of consumption data, that is such an important part of it. I mean, you can make it accessible, you can make it affordable, you can make it somewhat attractive, but if they're not putting it in their gob and eating it, what's the point? It becomes food waste. What are some successful strategies to change behavior? Or is that the $10 zillion question? Richard?
Well, I mean, since I was a Peace Corps volunteer 40 years ago, we're doing the same type of interventions on behavior change, growth monitoring promotion, food demonstrations, multimedia stuff, and we need to carefully measure if these programs work on the ground in the countries where you're working. Because yes, behavior change will work if it's done well and it's reinforced and you make immediate contact with the mother. But without measuring and assessing this in every case, we're not sure, and there's been a lot of programs with a lot of growth monitoring promotion that has had very little impact. So this is not like vaccinations or vitamin A supplementation where it's a pretty simple intervention. We constantly have to assess how effective each and every program is on the ground.
Okay.
Yeah, and I think I probably not surprisingly agree with Richard. To me, my mantra is we need to bring the same rigor into the science of implementation as we bring to upstream research. We really need to use information strategically, and I think those social and behavior change communication programs that do work is because they've been approached very rigorously from the get-go. Very good formative research to understand what are the social conditions that are driving people's behavior, how are you going to be change those levers, that you're rigorously then designing your programs, what are the channels that will actually reach people. It's usually some combination of channels, including media, including interpersonal communications. And then you are doing that constant monitoring and course correction. And there have been programs like that. I would trumpet, for example, the Alive and Thrive program that has been very much focused on improving breastfeeding behavior and complementary feeding behavior, with some really quite dramatic results in improving exclusive breastfeeding rates in Vietnam and Bangladesh. And I think it's applying that same rigor, bringing the evidence to the table, will get more credibility to those programs that indeed they are worth the investment.
But I think we should accept that it's going to be very, very difficult to change food culture and food habits. Mm-hmm. And therefore, I think interventions at the production level, that is at the farming level itself. So the CSIRO in Australia have come out with a non-glycemic rice variety and a non-glycemic barley variety. And they've already now commercialized that in various range of breakfast cereals. So in Asia, where there is high type 2 diabetes and because of rice consumption, excess rice consumption, if you have the holy grail of a glycemic-free rice, you don't need to fundamentally change eating habits without having the harmful impacts of it. Similarly, if you're used to drinking soda and Coke for your entire lifetime, and you want the taste, but you don't want the calories. The holy grail is to come up with something that takes out the calories and is non-glycemic and is stable under high temperatures. And that is, I think, a far more effective solution. So more investment and research needs to go there. But as you know today, the total global spend on agricultural research is about $4.5 billion. We need at least $50 billion annually to be spent to find the next productivity breakthroughs. Because between 1970 and 2000, while our productivity growth rate in agriculture was 2.4%, it halved between 2000 and 2010. And now agricultural growth productivity in the last 5 years is 0.14%. So you have to find the next breakthrough, and that needs significant commitment in terms of research. And that is not forthcoming today.
All right, thanks very much. Feel free to applaud. Now, Stefan, we've heard a lot about US-based development policy. Can you tell me how Germany is addressing its development policy in regards to food and nutrition?
Yeah. Well, as I said before, we just launched our One World No Hunger initiative. And you can compare this initiative with the Feed the Future initiative of the US. The same spirit, the same strategic thinking, so we are brothers in a way in there. First, we put all our activities in the area of rural development, agriculture, food security in a unified strategic framework, use additional financial resources for specific targeted catalytic measures. We strengthen partnerships with civil society organizations, private sector, and science community. And we foster dialogue on food security and nutrition in German society. We would like to raise the awareness that global nutrition matters really, issues really matter. Within that One World No Hunger initiative, we identified 6 areas of action, and there is where we really focus on them. The first is food security and nutrition as a real multidimensional, multi-sectoral issue. Really where we have to address these, in particular, this interlink between health of mothers and child and nutritional status and all that. Second, as a strengthening of resilience and avoiding of famine. As I said before, fragility and crisis is of growing concern, and the more countries with stable political situations like China and others find their way out of hunger, the more we have to pay additional attention to those which do not have these framework conditions. That is part of our responsibility. A third, innovation in the agriculture and food sector is absolutely important. Innovation is a main driver of not just of productivity gains, but also on the knowledge on how best to use the natural resources in a sustainable way. So innovation in a more comprehensive way is absolutely key. Fourth point is supporting rural transformation. That's another point that is, from our perspective, often neglected. Agriculture as a key sector is important, but at the same time we have to take a closer look and we have to be aware of the interlinkages between agriculture and what is going on in the rest of the rural areas. Agriculture is dependent on rural infrastructure, for example, access to roads, electrification, resource management on a broader perspective. Fifth point, protecting natural resources, and that nicely links to what you said before. We put a special focus on soil degradation and soil rehabilitation. Not that we are convinced that soil is the most important thing on earth, but simply it has been neglected for far too long time. We need more global awareness of the issues of soil facility. That is definitely necessary. And sixth area, secure and fair access to resources, in particular to land. The protection of resources is the one thing, but if we want to help people on their way out of poverty and hunger, we have to make sure that people have access to the resources they need to find their way out of it. In particular, we launched, just an example, we launched integrated multi-sectoral food and nutrition security programs in Ethiopia, Kenya, Zambia, Malawi, Benin, Togo, Mali, Burkina Faso, so there is a special focus on Africa, but we go beyond. For example, we started new programs in India and Cambodia as well. There is no one-size-fits-all on that. So in each and every country, we have to see where we really can make a specific difference. In one country, it is more the link with the health sector. In other, it's more the diversification of agriculture, the provision of nutritious food. In other cases, it's a link between water sanitation as a prerequisite for nutrition and all the like. Yeah.
Thanks so much. And now I'm not afraid. I'm happy to open up the questions to the audience.
Wonderful. Thank you so much. For our first question, I'd like to call on Cynthia Rosenzweig from Columbia.
Thank you very much. This is first a comment about all of the great panel talks and talks that we've had focusing on nutrition. I work in the area of climate change, and climate change will be affecting all of the interactions that we've been discussing. And both on the mitigation side, in terms of pressure for agriculture with its land use responsible for approximately 25% of greenhouse gas emissions, as well as changing climate conditions on the nutrition quality of foods. High CO2 alone reduces the nutrition of the green crops, for example, as well as droughts and floods, changing pest regimes. So my question to this panel is, several of you have mentioned climate change. How are you bringing in climate change into the great work that you're doing and sharing with us? It's just, I think we do need to keep right front and center this very, very strong challenge that climate change is posing to agriculture, food, and nutrition.
Thank you, Cynthia. Let's take one more from the audience and one from Twitter. Oh, yes, the woman right back here. Thank you. And please tell us who you are with.
My name is Ellen Levinson, and I'm Levinson & Associates. I have a question on formative research. Shawn Baker mentioned it as very important in order to get feedback as you move along to make sure you can adjust. And Richard Greene, you mentioned it in the context of, behavior change, modification, and communication, making sure it really works in each context. But sometimes the way programs are designed, they're aiming for objectives. You have a goal and you have an objective and you have an indicator. How do we build into more of our development programs this idea of formative research and of adjustments based on progress evaluations? I think that's critical, and I'd love to know how you're dealing with that. Thank you.
Thank you, Ellen. And a third one from Twitter. Elise Ellinger, one of our next generation delegates, has asked, when we're looking at consumption data for fortified foods, are we also addressing bioavailability and absorption of these interventions? And with that, Monica, I'll turn it back over to you and the panel.
Wow, all great questions. Who would like to take? Stefan?
Yeah, if I might like to start on the climate change question. I mean, of course, it is on mitigation and adaptation. And adaptation, well, is quite clear. Coming back to the question of smallholder agriculture, we need to provide the means for them in many different ways. But let me come to the mitigation side. Agriculture in many parts of the world is a main driver of deforestation. That's a matter of fact. And one reason behind that is the low productivity of that. So one key point is raising productivity. That is absolutely a win-win-win option. It is for the benefit of farmers, for smallholder farmers, and it reduces at the same time the burden on natural resources, on remaining forest areas as a carbon storage. And if we do it in a way that is sound for the soil, if we are able to manage soil in a proper way, we keep soil as a very, very important buffer and storage of carbon. And so keeping that nexus in mind, I think, is very important.
Thank you. Richard?
Yeah, just a couple of things. We are working on a climate-smart agriculture approach for Feed the Future, and we like to talk about the triple win, which is mitigation, adaptation to climate as well as adaptation, but also growth and production as well. And some of the stuff that I talked about, whether it's legumes, whether it's drought-tolerant maize and stress-tolerant heat-tolerant wheat, and others, will promote greater production and actually lead to greater nutrition. And so this is something that we see is fundamental to our entire Feed the Future approach. I wanted to say something about research, because there's a lot of aspects here. We do a lot of implementation research. We do some research, like I mentioned, with our nutrition innovation labs on nutrition-sensitive agriculture. But we also do such things as impact evaluations, where we take a counterfactual and look at our programs to see if our fertilizer programs result in change, and compare that to a comparable population without the intervention. We carefully do performance evaluations and cost-benefit analyses as well. So there's a lot of ways to learn from the data from our programs, in addition to formative research as well. This is a critical part of our program, and we've got a lot to learn, and these are important for us.
I have a slightly provocative view on climate change and how to. I think we'll be sitting here 20 years down the road and speaking about exactly the same things, with having made absolutely no progress. If you're not going to price externalities and the natural capital that you're depleting from the environment, you're not going to change anything. In most parts of the world, where 71% of the water goes into agriculture, that water is not priced and it's free. What do you think the farmer is going to do in terms of trying to extract maximum crop per drop? Does he have an incentive to extract maximum crop per drop if water is not priced? Germany has a water cost of $3 per cubic meter. US has a water cost of 75 cents per cubic meter. And water-stressed countries in the developing world have much lower, if not no cost for water. And the same thing for carbon dioxide. We all got into a tizzy when we had the global financial crisis. The estimate losses that we suffered during the global financial crisis was $2.5 trillion. Every year, we are depleting natural capital of the order of $2.5 trillion. And it is not on anybody's radar, because it is free. And Mother Nature is not invoicing us. So unless we start pricing it, we'll sit here 20 years later and talk about the same issues, having made absolutely no progress.
Interesting. Shawn?
Yeah, I was going to start with the third question and then move to the second question. So I think the question was around bioavailability of fortified foods, et cetera. And I would come back to the theme of making sure your programs are data-driven, because when you need to have the data about consumption patterns to select your food vehicles. You need to understand how those feed vehicles work through the system. So how much will be lost? Make sure your fortificants are bioavailable. So those are things that actually need to be factored in, that information in the very conception of your program, and then be monitored. And I think that's what the term that Richard used about effective coverage. Then at the consumption level, are individuals actually consuming foods that are effectively fortified? So those are all elements that absolutely need to be taken into consideration. But that from the get-go, the design of the programs are driven by available data. I think on the formative research question, and I while I sit representing a donor now, I spent most of my life on the other side of the table, and I think I know very much the spirit of where that's coming from is how much can one be flexible and course correct based on what you're learning during the implementation of a grant or a program versus how rigid is it. And I do think in an ideal world you are building in that flexibility to say, look, this is an ongoing journey of discovery about how things work. If we have good data and that we have an ongoing dialogue between the investor, be it the national government, a donor, or whomever, and the implementers, that is a good way of doing business. And I think the best relationships I've had with donors when I was on the other side of the table is when you have that spirit of collaboration, you're in this together. And the best relationship I have with grantee partners on this side of the table is that same sort of a relationship. And ideally then the time to keep doing those course corrections and alignment on the long-term vision of where you want to get.
Mm-hmm. Thanks so much.
Can I just add one thing? I think in terms of policy choices we make as a result on mitigating the impacts of climate change. So today we are hoping that we will get an agreement to limit global warming to less than 2 degrees centigrade and carbon dioxide concentration in the atmosphere of less than 450 parts per million. But we know that temperature growth of 1.5 degrees centigrade and carbon dioxide concentrations of 350 parts per million or more than that will destroy all the warm water coral life as we know it completely. So by accepting 2 degrees global warming increase in temperature and 450 parts per million carbon dioxide concentration, we have made an ethical choice that we don't want warm water coral reef life to exist. How many more such ethical choices are we willing to make? And that is because we have a completely different way of recognizing whether climate change is a hoax or is it a serious problem. And unless we have a consensus on how serious this issue is for the future generations, I don't think we will take some of these drastic measures. We talked this morning about food waste. I don't believe that we are going to solve that problem. We have talked about it 30 years ago, 20 years ago, 10 years ago. We're talking about it still today. The US, at the consumer end, wastes 220 million tons of food annually. That is about the entire production of food grains in sub-Saharan Africa, 44 countries put together. And in order to prevent waste, a third of what we produce, we need an investment of $4 trillion by 2050. $4 trillion in cold stores, silos, storage and logistics investments. It's not going to happen. So we'll always have to contend with food waste.
Thank you so much. We have time for another round of questions. Rajul Panyalorch from the International Food Policy Research Institute.
Thank you very much. I have a question for Stefan and then a related question for the other three panelists. Stefan, it's wonderful that Germany is putting food and nutrition security squarely on the G7 agenda. And if it is not inappropriate to ask, how do you expect the other G7 members to respond to that? How supportive are they? What are they putting on the table, or what do you hope they will put on the table? And the other three panelists are extremely articulate people, and I'm curious, what would you want to ask Stefan to put on the table for the G7? What is your ask? Ask to him. Thank you.
Thank you, Rajul. I'd also like to ask Andy Jones from the University of Michigan and also the lead drafter of the Chicago Council's report released today. And he's right over here in the second row. Marcus?
Thanks very much. I had a question about this issue of behavior change and how difficult a task it is. It seems like starting with what people are consuming is a very good place to begin. However, I'm wondering, it seems like sometimes there's a disconnect between how we talk about behavior change towards healthy foods and behavior change towards very sort of more maybe ultra-processed foods. And I'm thinking particularly about the challenge of when we talk about moving diets more towards maybe diverse diets, how difficult it is to change food habits. But we've seen, even within a single generation, there were several examples this morning on the panel discussing how rapidly diets have been changing, even within a single generation, away from traditional diets, more towards highly processed diets. And so I'm wondering if the panel thinks that there maybe is a disconnect between how we talk about these two things, and if there is some disconnect, is there a role for having the right kinds of economic incentives and also sort of the massive investments we've seen in commercial marketing that have been very successful in changing diets in a very profound way across the globe in a very short period of time? I'm wondering if we can leverage that to make impacts on changing diets in a way that we would like to see.
Okay, great. And we'll take one final question from Twitter, and this comes from @KangK. And she says, is there any country where the food, agriculture, and health sector work well together to address nutrition?
All right, who wants to start?
Well, Stefan has a question immediately.
Yeah, I think Stefan should start.
And I'll follow up,
Yeah.
and then I'll ask something to Stefan.
Well, in general, all of our friends and partners in the G7 are very supportive of that. There is a broad consensus, in particular on these areas. I shortly mentioned on smallholder agriculture, on the need for sustainable development, responsible investment, and nutrition in particular. We are talking here, and so on and so on. We are in the middle of, talks, discussions, negotiations right now. Beg your understanding that I can go into detail, but it's in the end it's a question on how ambitious we are. But I can assure you that we are ambitious, that we go the wrong way, and that we have really, it's astonishing, that we really have very constructive and productive discussions. Yeah.
So, Shawn, your suggestion for what should be on the G7 table?
Actually, I want to reframe it slightly, so that's not punting necessarily, but it comes back to some of my opening comments, is that, and part of this I'll inform from a personal perspective, having worked in nutrition issues for 30 years, I feel that finally we've come out of the shadows and we're at the center of the development issues. And this is absolutely no time for complacency. So I think anything we can do, we should be taking advantage of any global gathering, such as this one, such as the G7, to make sure that nutrition is there. So anything Germany and the other members of G7 can do is greatly appreciated. So thank you, Stefan, for that leadership. So I don't want to be specific because I think those details will be worked out, but I think that we're systematically taking advantage of these big moments to continue the energy around nutrition, because this is not something that's going to be, it cannot be flavor of the month. This has to be going forward at the center of our development agenda. I wanted to then respond to the behavior change.
Yes.
Or some responses. I think that, I think there were some very interesting points, and perhaps first the context of, if you look at what is invested through more generic public sector channels to improve social and behavior change oriented towards healthier diets, including optimal breastfeeding, optimal complementary feeding, versus what's invested by the private sector to promote specific brands, there's a total imbalance. So I think, yes, there is an imbalance here. I think also we need to look at the convenience factor. Often what will drive adoption of new foods will be very much related to convenience. It comes back to something Richard said about how one of our absolutely most valuable commodities is mother's time, and often her decisions about what she purchases and then use in the household is going to be very driven by the time allocation. So if we can make healthier diets also more convenient diets, I think it gives us a big leg up. And we also see that, and you saw this, I think, very much in the food price crisis of 2008, you have a lot of our more nutritious foods, in fact, are the higher priced commodities, and that's what takes a hit when there are economic constraints. So there are certainly economic incentives. And so Granted, social and behavior change communication, changing food habits can be difficult, but I think this is where really insightful formative research to understand what are the real drivers of the choices people are making about foods. And it's not just, there are many different many different levers we can pull, but we need to understand them.
I have one wish list for Stefan, G7, and also if anybody from Turkey is here for the G20. Because I think G7 and G20 leaders really pay lip service to improving sustainable food production. One request would be, can the OECD countries that last year paid $350 billion of farm subsidies to its farmers remove all farm subsidies and help the 805 million people who are undernourished by redeploying that funds there? I know it's a very simplistic, very provocative suggestion, but if you want a real solution to this problem, there is no business where you can afford, if you're free market proponents, you cannot hide behind the fact that you will support $350 billion of farm subsidies to your farmers. Jacques Chirac, the former president of France, had said, the word agriculture, the operative part is culture. And over my dead body, any subsidies will go from the EU. Right? 37% of the EU budget is to farm subsidies. China pays $250 billion of farm subsidies last year. And why should it, as we heard Greg Page mention this morning, the countries that have a natural comparative advantage to produce a particular commodity should be allowed to produce that, and they should get a fair value for that.
Just quickly on the point of food marketing, I don't know, but you're probably familiar with the Partnership for a Healthier Generation and their soon-to-be-launched campaign, Team Fruit and Veggies, where they have an ad company that did the ads for Coke, pushing broccoli and carrots now with celebrities and sports figures. So I think this is the first time we're going to see any marketing sort of on that level. Whether it works, well, it remains to be seen.
Well, unfortunately, that's all the time we have. Please join me in thanking the panel.
Thank you.